Hello and welcome to a new episode of Another Angle. My name is Abby and I'm on a mission to help our listeners learn about ways on how to improve their health, their fitness, and their overall well-being. We will be joined by guests and specialists from sectors like medicine, nutrition, and fitness who will be bringing you the latest advice and the latest trends in what's happening in today's world. I would like to introduce you to Dr. Lean, who is a GP and she works currently in the NHS. Dr. Lean, would you like to tell us more about yourself?
Hi, everyone. I am Dr. Lean, and as you said, I'm a general practitioner working in London. I am currently working with the NHS, and one of my passions is preventative medicine, basically trying to prevent a disease from happening before it happens rather than get the disease and treating it after it happens. So I'm also trying to get a degree with functional medicine, which kind of collaborates well with preventative medicine, which takes a 1-year course, which I'm currently doing. So yes, that's my background. And as a general practitioner working at the moment with the whole of coronavirus and everything, it is busy. The whole kind of practice has changed from what we do every day and is definitely more intense.
As people that are actually on the receiving end of the news that we hear every day, you are a hero at the moment. And I'm not saying this in any cheese way, to be honest. It's really fascinating that there are people that are ready to put their lives at risk and are able to be at the front line of fighting this pandemic, which is coming at a very strange time. No one would have imagined that we would live to experience such thing. How is that like for you as a doctor? Like a month ago, I see like one of your posts on social media, you were just enjoying your life. You were just can't wait to get home and chill. And so tell us a little bit more, like, how is it like as a GP at the moment?
So it feels surreal a little bit. It feels like a war, and the army being the doctors. That's how I feel the situation is, but the war is against this virus. It is completely different for everyone, really, not just for doctors, but specifically in terms of how we work, because the situation where urgent things such as heart attacks and strokes are still happening, as well as the coronavirus cases that can be quite dangerous. So it's trying to find a way to try and tackle the coronavirus and tackle other emergencies. And not seeing patients. So all practices in the GP have moved into telephone triage. So we don't see patients anymore unless we speak to them first, make sure we discuss the risk, and then we bring them in depending if they need to or not. So yeah, it feels completely different. I had many travels booked, which obviously we can't attend to anymore. They have sent us emails saying that, the bank holiday, which is just coming up in April, that GPs will have to, and all NHS workers will have to work during these days, and they can't take it as off due to the pandemic and what's happening. So yeah, everything has changed, but we are in this together, and hopefully we'll pass through it.
So you mentioned that at the moment is it like a new system, this triaging system where video conferencing has to be implemented, or has it been the case from the start?
So we had a mixture of face-to-face and a telephone appointments where the patient can make the decision whether I want to see a doctor face-to-face or I just want to speak to a doctor. It doesn't need me to see it. But now the patient, unfortunately, does not have that decision. It has to be telephone triage, and mainly we try to treat patients over the phone, because even if we bring them into the surgery, it will put these people at risk of getting the virus, because we do see high risk people in the surgery. So it's for their risk and for our risk, because there are also asymptomatic people who are carriers and still can transmit the virus. So it's a very difficult situation. But yeah, it's only triaged by a doctor first. And then they are brought in according to that doctor's view.
I see. Okay. So what is the criteria at the moment to see a patient? I saw that they need to have like a list of basically they would having comorbidities. There's a lot of different elements to it. And that's like one of the things that it's causing a lot of worry from people. Like as a company, as you know, like we have launched this COVID-19 test. And what we found, there's a lot of people saying why the test is paid for. Why do we need to pay for this? Especially on social media. And the fact that the concept of private healthcare is not so common in the UK, people like expect it to be for free. We try to get people to understand that yes, you can be tested within the NHS, but at the same time, there is a criteria for the testing itself. Obviously, this is just to reduce the pressure on the NHS because resources are limited. So, what is the current criteria for testing? If someone wants to get the test for free, who is eligible to get the test?
So that's a very good question. Me and plenty of my colleagues do want to get tested, but we still can't get tested. So the criteria for getting tested at the moment is needing admission to hospital. So if you're very unwell to the point that you're short of breath, unable to complete a sentence, you're having difficulty to stay at home where you need extra support from the hospital, that's when people are getting tested or being on ventilators. So very little amount of people are tested at the moment. Many healthcare workers are off work either because their family members have got symptoms or they've got them symptoms themselves. Even if they're feeling completely well, according to the government advice not to go in. So they'll have to either work from home or not work, depending on the situation that they have. And they still won't get tested, mainly because of the shortage of testing kits in the UK, which is the problem. And they're trying to get it through. And as you can see from the news, they are trying to get the immunity tests, the antibody testing, but they're still looking at their sensitivity and specificities and trying to partner with that, yeah.
From my point of view, I feel that, okay, it makes perfect sense to test people who are at that risk, patients who are at in that risk group should be tested so we can protect them and shield them and do all the other bits and pieces that the government have mentioned. But at the same time, it feels to me that, because looking at the statistics, by the way, just to give some context to our listeners, I had a look at the statistics yesterday, and currently the UK in the top 5 or 10 countries in terms of cases of COVID-19. The number of patients, however, that have recovered is in the 137, I think, as of today, which is the 1st of April. When you compare it to all other countries, it's so trivial in comparison to all other countries. And the only explanation for that, it feels that the reporting on the cases that have been confirmed to have COVID-19 are coming in patients who have that risk. So it feels to me that the NHS is putting a lot of resources in caring for patients in these risk groups, and there's not much resources put on testing, which basically could discover the transmitters who would basically be spreading that virus to the vulnerable and the ones that would later on need to be taken care of. So do you feel that the strategy that the government is currently taking is the right one, or do you think it could be changed in the sense that it would be focused more on offering more testing for free for patients that might be suspected to have coronavirus?
So I completely agree with what you're saying. The numbers are, I feel that they're completely inaccurate because there are so many numbers out there with coronavirus that do have it and have recovered from it, and we don't have the numbers. So I feel testing should have been really placed early on in the pandemic, where we knew that it is coming, and it should have been done very early on, where you could get tested, isolated, and make sure that you trace. So you trace back to whoever got in contact with that person and then try to avoid that as much as you can. But obviously because the testing wasn't available and from how many people were getting coronavirus, they're not doing tracing anymore. And it's just that the numbers are so much higher than we could imagine. They're trying to get figures, but that's always rounding and approximate. There is also an app, I don't know if you've seen it, that's been done by Guy's and St. Thomas's and King's College Hospital, trying to get as many people as they can, trying to get to the app and say what symptoms they've got. And even if you're well and you're fine and you don't have symptoms, go on there and say you don't have symptoms. And they're trying to get an estimate of how many people in the UK do have the virus. So that's a way to try and find out how many cases there are.
Because, like, for me, it seems that the stance that we're taking at the moment is more reactive than being proactive in terms of tackling the pandemic by finding exactly who are the people who are infected and trying to get them into quarantine so we make sure that the transmission is as minimum as possible. But as you know, and as everyone can agree, staying at home is gonna still be the gold standard to make sure that the spread of the disease is slowed down. And we hope that more people can really listen to this. This morning, I think I was watching Good Good Morning Britain, and I found that they were reporting on a scene that it was in one of the train stations where people are still going to work. But let's not just like really move into that because it's a whole different subject about why people are still
Yeah,
going to
interesting.
work. So tell me a little bit more about preventative medicine. Obviously, that this is something that if it was more widespread in the early days or like even in the years before the pandemic, it could have helped get people to have better immunity, maybe. What role do you think preventative medicine could have played and could play at the moment in controlling the pandemic?
So prevention of the virus, it's very difficult, but the most important things, which is what the WHO and the government has been trying to put in place, which is mainly washing hands, trying not to get in contact with someone who's coughing, sneezing, because we know this virus is traveled through droplet, and trying to avoid being around someone who's coughing or sneezing is best to prevent it from happening. And other than hand washing, in terms of vaccines, this obviously can play an element, but we don't have that at the moment, and it can take up to a year and a half for it to be put in place. But mainly it's what we've been told to do, and that's how we try to prevent the virus itself. I feel that in terms of immunity, it won't stop you from getting the virus. Yeah, you might be able to shed the virus quicker and defeat the virus quicker throughout your body, producing antibodies, but it won't stop you. It won't prevent it from happening.
So, what does preventative medicine really mean to you?
Preventative medicine is basically preventing a disease from happening in the first place. So there are so many diseases that are preventable, but we as doctors mainly trying to deal with how to treat diseases, and we're not really taught about how to prevent it, mainly with nutrition, exercise. And if you look at the medical school curriculum, you'll see that nutrition is very rarely taught, like taught just a little, maybe a week or two, just about nutrition, which is the main thing of how you can prevent diseases and how you can prevent it from happening in the first place. Preventative medicine needs to be individualized. So what we need to do for you could be completely different, or what we need to do for someone else, depending on their background, their family history, what things run in their family, and that's where genetics come into place as well.
I think it was Hippocrates who said once, it's way better to, please correct me how, if I say it in the wrong way, but he said that it's way better to treat the person than treating the disease. Is this the ethos you think that preventative medicine is all based about? To be able to understand the person and be able to see what kind of person you are dealing with rather than trying to determine what disease the person might have?
So this also comes into another element that can be placed into preventative medicine, where if you take a whole person and you understand their, let's say, their socioeconomic, their social background, where they come from, where they live, what they do, what they eat, then you're more likely to understand what you can do for that person. If you just get, okay, they've got diabetes, you take this medication, this medication, you might actually do lifestyle changes that can help bring, treat and prevent it, depending on the situation. So yeah, that comes into practice in preventative medicine for sure.
But why do you think it's still not streamlined? Why do you think that medical schools do not really push with that as the first line of treatment, let's say, trying to focus on those things? Is it because the way the healthcare system has been set up to be reactive?
This is a very good question. There could be many reasons for it. There is, if you look at the guidance, so basically all doctors use NICE guidelines to help them with treating patients, and they're very thorough. They're just very important for our clinical management. And always, if you actually read them, at the first stage of if treating every disease, they do mention lifestyle, they do mention diet, they do mention exercise. But how much the doctor focuses on that really is individualized. First of all, because of medical schools, and I think the way we are treated mainly comes from that there's time, there's whether there's funding, that's a different question that comes into place, whether pharmaceutical companies, blah, 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 but that's not less likely in the UK than the US. And then mainly in GP land, it's the time of the appointment. So if I have a patient coming in for treating of hypertension, I only have 10 minutes with that patient. So imagine how much I can talk about diet and exercise and giving them medication, telling them how to take the medication. And it's very difficult to do all of that in 10 minutes, so you end up skipping the diet and exercise and just dealing with what they think is the important thing is giving the medication. Yeah.
They just want to get that drug, right? So just giving them that pill or whatever thing that will get them feel better, right?
I am pro when if you need a medication, then definitely take a medication. But you do need to emphasize mainly on prevention and trying to prevent it. But once you reach the level of you need it to prevent, for example, to prevent a stroke, you need a medication for
Further
high blood pressure.
complications.
Yeah, exactly. So
Yeah.
I'm not against medication, but I am against it when you don't need it. Yeah.
I like to take things in a philosophical way. Like, I know that sometimes doctors might not like to talk about things that are not factual, but do you think, as a planet that we live in, the Earth planet that we have, do you think that it's trying to send us a message in terms of that pandemic have happened for a reason for us to change our way of living or the way that we look at healthcare? Do you think there's a lesson for us to take from this pandemic?
Yeah, absolutely. So we all know that the earth is overpopulated, and whether in what we eat, we need to change, depending on China and and if you can see how when everyone is self-isolating, how the ozone layer and it has changed. So it definitely shows that there are so many things that we can do to help in improving how we're living and to prevent another pandemic in happening again, mainly by preventing I was going to say the mutation in animals, but this is a difficult one. You never know when it's going to happen. But trying to be more vigilant and more hygiene would be definitely an important thing to be put in place.
Absolutely, absolutely. I think that would be a great thing to take away, I guess. And there's a lot of things that we can also do as a society to help the NHS. Do you have any kind of top tips that you could basically be able to share with us in terms of, like, as a society, what can we do to help the NHS and the frontliners like yourself to really first get over this pandemic, and second to make sure that we are better equipped to deal with it in a better way in the future?
First of all, stay at home because I know it's like said all over the news, but it's literally the best way you can help the NHS. You still see people, as you said, like going to work who are non-essential workers. You see people in the parks who are talking to each other and they're not taking it seriously. They think, yeah, we're young, we'll be able to survive that. But they do understand that, even if you're young, that doesn't mean you can't have it and it can't be severe. And second of all, you can work as a carrier or you can transmit the virus to other people. So by staying at home, it would really, really, really help reducing the pressure on the NHS and trying to, and I guess in the future is by accessing the healthcare system when you need it. Yeah, it's a difficult one to talk about in terms of how we can help in the future. But for now, definitely stay at home, and I would follow the government guidelines, which I do agree with.
Do you have any top tips that you would basically be able to share with our listeners to have a healthier lifestyle? You are one of the influencers that are on social media, and I personally had the pleasure really going through your feed, and clearly you are someone that really takes good care of your lifestyle in general. So, as a medical practitioner and as someone that is really at the top of lifestyle medicine and taking good care of yourself in general, what kind of advice do you give people so they can implement at home during this lockdown?
So I definitely try to do exactly what I preach because I do believe that it's very important. Going back to preventative medicine, so that's how you prevent anything from happening and that's how you stay healthy. Main thing is if you're at home, and top tips in trying to understand more about your health. First of all, you can draw a family tree and speak to your parents, speak to your grandparents, see what runs in your family. That's one thing that you can do and see what your background is. And two other tips, which I guess it's worldwide known about healthy eating and exercising. If you're finding it difficult to find motivation to exercise at home, I would suggest getting, videos online, following, like we were talking about Instagram, following people who would motivate you, who would give you some tips on how to exercise at home is very important, and who will give you healthy tips on what to snack on and what to eat. So knowing what you're at risk of and how to prevent it, healthy eating and exercise, and trying to get motivation from different ways and what works for you.
So do you think that people will start now paying more attention to themselves to in regards to what really is good for them and what's not good for them? I know this is like just a follow-up question, but it's really interesting what you mentioned now in terms of preventative medicine, because as a company that have done DNA testing and we have been doing this for a few years, it came to us so apparent that the main reason why people come to us to get their DNA tested is out of curiosity to start with, and second of all is because they have done a lot of things that did not work for them necessarily in terms of their diet or their exercise, or not knowing exactly how to manage a condition. Like, as you know, you mentioned NICE guideline, which is the National Institute for Clinical Excellence, which puts the guidelines for doctors to follow. And usually the guidelines go like, if drug A doesn't work, go to drug B. If B doesn't work, go to C and D, and then keep going down that route. What personalized medicine could offer in terms of precision medicine and genetic testing, a precise overview about the patient's metabolic pathways and how they can really metabolize the drug. So without going through that trial and error, you can straight away prescribe the right drug to the right patient at the right time. And that would also save a lot of costs. So do you think this is something that we will see more of in the post-COVID-19 pandemic?
Oh, I'd hope so. It's something that I definitely see with patients who've done it privately, who come in to see me and say, I've got these tests. Can we go through them together? And absolutely, I can go through them in the 10 minutes. But I think it's mostly a funding problem, which would be difficult. But if that could be installed for the NHS, it would really change quite a lot of things. And it would help a lot of people, yeah.
Great. So thank you so much, Dr. Lean. It was a huge pleasure, like really having you on our podcast. And I would like to reiterate our gratitude for your effort at the NHS and what you're doing to save lives in these difficult times. To close with, I think all we can say is good luck, and hopefully we will come out of this stronger and better. And we hope to have you on future podcasts as well.
Yeah, absolutely. And thank you for having me. And we're all in this together. And as you said, hopefully we'll get out of it all healthy and fine.
Thank you very much. Have a lovely day.
You too.
Thank you. Thank you for listening to today's episode of Another Angle. We hope you found some useful information in today's podcast. Feel free to share it with your loved ones. And please do let us know in the comments which areas or topics you would like us to discuss next. We would love to deliver that right knowledge right to you. Stay safe.